Well, last month we told you about Lisa Sheehy. She is a Rogers mom who had breast augmentation surgery at Bashioum Cosmetic Surgery Center. Now, she says she's finally comfortable in her own skin thanks to this mommy makeover. Well, today TCL producer Kelly Hansen introduces us to a Hudson mom who isn't a stranger to cosmetic surgery.
What do you want to eat?
It's been just over a month since mom of two, Brooke Fleetwood, was in the operating room undergoing breast augmentation surgery.
They need to be new and perky again. I want bigger because my frame is bigger now. I have a little bit more curve than I did when I was 18.
You do your surgery, we're going to take the fluid out.
At 18 years old, Brooke had her first breast enlargement surgery, going from a size C to D. But after having children and breastfeeding, Brooke says those saline implants didn't look the same. During the procedure, plastic surgeon Dr. Ralph Bashioum removed her implants and replaced them with larger ones that contained more volume, filling in the upper part of her breast.
Say, vroom, vroom, vroom.
1 month later,
amazing. I love the results. Love them.
Because Brooke already had implants in place, she says this time surgery wasn't nearly as painful.
They said that it would be pretty painless, and it was. And I was super scared because the first time it hurt bad. It was easy.
Brooke didn't want to change the size of her breasts, but wanted them back to how they looked after her first surgery 7 years ago.
It just filled in the area that was missing.
Brooke's initial surgery was performed by a different plastic surgeon, and Dr. Bashioum was able to fix scarring from that procedure.
My old scar was pretty thick and pretty noticeable. He took it out and redid it. And now you can't even hardly see it.
It's only been 1 month, and Brooke says she's back to feeling beautiful.
Well, Dr. Ralph Bashioum is here. Dr. Bashioum, nice to see you. Thanks for being here.
You're welcome.
Okay, so let's talk a little bit about this procedure. It seems like it was pretty simple, and she says she didn't experience much pain. So is that common for this one?
Very much so.
Yeah.
Women that have had breast enlargement, have gone through having children, will frequently ask about their breasts having changed. Either they're smaller than they were before or larger than they were before. In her case, they were smaller than what they were before. So what we did is we replaced her implants, and typically it is very easy to get through.
It is. Okay. So let's talk about this surgery in general, breast augmentation, before or after you have children. Do you think, I mean, she had it done pretty young. Is it a good idea to say, I want to take this step before I have kids? Or if you're thinking about having kids, is it a better idea to wait a little while?
That's a personal choice.
Yeah.
You know, if you're uncomfortable with yourself, I think that this is a great choice.
Okay.
Yet some women do wait until after they've had children. I will tell you an interesting story is that we did have one woman who had problems with fertility. She had a breast enlargement. 6 months later, she was pregnant with twins.
Oh my gosh.
So
what do you think was going on there, Dr. Bashioum?
She has to be comfortable with herself, and, and so much of whether it's breastfeeding or whether it's infertility has to do with your how you see yourself and how you feel about yourself, and that's what makes the system work.
Yeah, absolutely. And the breastfeeding issue, people I'm sure ask you about that a lot.
Yeah.
If they're going to have breast implants put in at a younger age. What do you say about that issue?
Well, there's a risk of nipple numbness whenever you do breast enlargement surgery with implants, not with fat transfer.
Okay.
But if they have loss of nipple feeling, then it can interfere with breastfeeding. Yet the La Leche women say that 100% of women with breast implants can breastfeed.
Okay. And we talked about this before, but I think it is important to go back to the saline versus the silicone. So a couple of the differences, and what are most women getting these days if they're getting implants?
That depends on what they're offered,
Yeah.
and if they're given informed consent, which is a very important part of our practice philosophy, is that when given the choice, women think this through and they accept peace of mind of saline implants because they never have to worry about them.
Yeah.
They never have to have surgery on their breasts again. Where there's silicone gel implants, there's maintenance, there's a $1,000 test the third year after surgery, every other year after that.
Wow.
And we even recommend replacing the silicone gel implants at 10 years before they break. So when they think it through, most women will choose saline.
Okay. Do you think 18 is too young? I mean, I know 18 is that the youngest age that you'll do this surgery on someone?
That's the youngest age I'll choose to do the surgery because
yeah.
until then, intellectual maturity has to take place to a certain extent. And 18, I think, is a legitimate age to do that. Saline implants are available at age 18.
Okay.
Silicone gel implants are only available at 2021.
Okay, so what are the first steps? If you're thinking, all right, this is something I think I want to do, what are the first steps to find out if you're a good candidate, and who would this be good for?
I think the first thing is to talk to your physician, your primary care physician, to see what they suggest, if there's any other issues that would suggest you should not have the surgery. Once you've done that, ask your physician for the name of a surgeon, ask friends for the name of a surgeon, go out to the internet and look around, look at pictures and see what they've said, then set up 2 or 3 consultations with physicians, pick the one that you're most comfortable with. That's the best advice.
And I've heard that the scarring now is so much less of an issue than it used to be.
It is the tiny scar. When you do the saline implants, the scar's not an inch long.
Wow.
When you use silicone gel there, it's bigger. It's a bigger scar. So that's another disadvantage of the silicone. So yeah, it's a tiny little mark covered by the smallest bathing suit that most women would choose to wear. And women are uncovered. It's difficult to see, difficult to find.
And then what other kind of procedures do you think women, you know, maybe in their 20s, 30s, and 40s, what are they thinking about today? I mean, I know breast augmentation has been popular for a long time, but what are some other things that women are coming in and saying, hey, can we do something about this?
Well, the second most common surgery we do is liposuction.
Okay.
The nice thing about liposuction, it can reshape the figure a little bit, and we can take that fat and put it someplace else in your body. It's sort of the bleeding edge of cosmetic surgery and plastic surgery, where we can enlarge a woman's breast that way.
Yeah.
It has replaced, in my practice, all of the fillers of the face. So we don't use the man-made fillers. We use fat on the face to enlarge the cheeks, lips, fill in lines.
Boy, finally it goes where you want it to go, right?
That's right.
Dr. Bashioum? Dr. Bashioum, thank you so much. We
You're
appreciate
welcome.
you being here. And if you want to call Bashioum Cosmetic Surgery Center, you can schedule your consultation today so you can find out more. We posted more information at twincitieslive.com, and we want to thank Bashioum Cosmetic Surgery for sponsoring Twin Cities Live. Nice to see you. See you soon.